When the patient is inpatient, right, the management of those behaviors and those processes and the diet and getting the patient into the rehab gym, getting the patient into physical therapy, into occupational therapy, they're here, they're in the building, so those are logistics, time management, people management, implementation of program. Those processes are easier to manage when we have the patient here. So, the physician writes the order, and we have a clinical team here and a rehab team that carries out those orders based on the SNPist or the transitionalist orders. And as long as we have the patient here, which is similar to a hospital experience, there are controls in place, so we typically have good compliance. There's someone who literally goes, ma'am, it's time for your rehab, and we literally go with them to the gym and ensure that they get there, that they get it done, that they get the prescribed minutes of rehab time. Where we run into challenges with patient compliance is really once a patient has completed their acute and their post-acute experience and they're discharged to home. That's where we typically run into challenges, and it's particularly important, I think, for folks watching this and listening to this to understand that with a medically complex patient, they typically also have some functional limitations. So these are folks who, once they're home, probably are in need of some of what we call ADL, activities of daily living type assistance, meaning that maybe they need some help, getting up and getting dressed in the morning. Maybe they need some help walking to meals. Maybe they need some help, dining and getting into the bathroom and things of that sort. So they're dealing with those functional limitations. In addition to that, there can be transportation issues, and there can be the need for community support or social services type issues. So in the face of all, so you have a patient who has functional limitations, who's working through these other challenges, and we're also saying, oh, by the way, you've got these medications you have to take, and you have these doctor's orders that you have to follow, and you also have all these dietary restrictions that we need you to make sure you follow. So what we find is once the patient gets out of the inpatient side and gets home, it becomes more challenging. And so once there are ways that we try to manage that. We can do, there are telehealth solutions that we can use with certain types of patients, which means a patient is attached to some form of a monitor that Bluetooths to a device that we can then log into via the internet and check a patient's vitals. That's a subset of our patients. The biggest problem that we run into with patients, though, is really non-compliance with the orders once they're home. Dietary is a huge one. I can tell you that we have, this is a true story. We've seen a patient readmit to the hospital, a $30,000+ readmission because they ate a $2 bag of Lay's potato chips. There are, the clinical guidance that patients are given when they go home are based on the clinical expertise of the physician and the clinical team, but are also evidence-based, meaning that we're making decisions based on what we know from hundreds and thousands of other patients. So to the degree that we as a healthcare industry, family support at home, doing what they do, community support, to the degree that we're able to help patients comply with those orders, ultimately we're going to have better healthcare outcomes. We're going to have healthcare delivered at a lower cost because you're going to have fewer readmissions to the hospital, as well as other procedures that can result, right, when a patient who has some issues already doesn't follow orders, and ultimately that's going to drive better overall population health. This is a healthcare facility that is staffed by clinical professionals, by rehab professionals. It is their job in those instances where a patient doesn't feel like doing rehab on a particular day, to convince that patient that he or she ought to get up and come to rehab. So, with rare exception, when a certain clinical procedure or rehab has been written and ordered by the overseeing physician, with rare exception, we get compliance on the inpatient side.